Good morning. Hey, I'm Nicole Otto. I've been a nurse for 35 years. Thank you for watching our channel. Wanted to tell you, I just got out of the hospital last night with AFib and wanted to give you a little insight. It is no fun. So you have a 4-chamber heart. The 2 top chambers are called your atrium or atria, and the 2 bottom chambers are your ventricle. When you have AFib, the top part of the heart is quivering instead of contracting. That quivering can cause palpitations, make you short of breath. Some people have chest pain. It's not fun. It just means your heart is not contracting effectively, and so you can get lightheaded and dizzy. AFib with RBR, which I have, as when the ventricles at the bottom part of the heart are also quivering. So everybody's joined the party. So the whole heart is now quivering instead of doing that nice lub-dub. So that's happened to me twice in the last 8 months, and I've had to be in the hospital overnight. We did some medication changes. Presently, I'm taking cardizem 30 milligrams twice a day. That is a calcium channel blocker. It works great for AFib, and there's different dosages that they'll order. Every patient's a little different. I am able to feel when I'm in AFib, I know, and it's just not pleasant. Most people, or a lot of people, can't tell when they're in AFib. They just may feel weak, dizzy, and lightheaded and think it's age-related medication side effects, when in reality they're having an issue with AFib that needs to be addressed. If you are having symptoms of AFib, if you're not well controlled or established with a physician, get to the ER, especially if you have the RVR. AFib by itself in the upper atria is, a medical issue. When you have the RVR, or your ventricular rapid response at the bottom with the ventricles, that is a medical emergency. We need you to get to the hospital because the whole heart is not beating efficiently. So when that happens, they need to get you on usually an IV drip of cardizem. Some doctors will use amiodarone. But anyways, thanks for watching. Next time we'll tell you a little story how we ran into somebody on a hiking trail and AFib and what we did. And this was before I had been diagnosed with AFib. So I wasn't real hip on the feelings of AFib, but I, as a nurse, knew what was going on when I felt her pulse and her heart. All right, have a great day. Thanks for liking and subscribing. See you next time.